Sleep is a fundamental biological necessity that plays a crucial role in our overall well-being, particularly when it comes to our mental health. However, in the fast-paced, technology-driven world we live in, many individuals struggle to get the quality and quantity of sleep they need. The consequences of poor sleep can be far-reaching and devastating, affecting various aspects of our mental health. In this in-depth exploration, we will delve into the intricate relationship between sleep and mental health, shedding light on the alarming consequences of sleep deprivation and offering insights on how to prioritize and improve our sleep habits for the betterment of our mental well-being. Sleep and mental health are intricately intertwined, with each profoundly influencing the other. Adequate, high-quality sleep is essential for maintaining optimal cognitive function, emotional regulation, and overall psychological well-being. Conversely, poor sleep can have a detrimental impact on our mental health, leading to a host of issues that can significantly diminish our quality of life. One of the most evident consequences of poor sleep is its impact on cognitive function. When we don't get enough sleep, our ability to concentrate, focus, and process information becomes significantly impaired. This can lead to difficulties in decision-making, problem-solving, and memory formation, making it harder to perform daily tasks effectively. Reduced cognitive abilities can also contribute to decreased productivity, as individuals may struggle to complete their work efficiently or find themselves easily distracted and unmotivated. Sleep deprivation can have a profound impact on our emotional well-being. Insufficient or poor quality sleep can lead to increased irritability, mood swings, and emotional lability. Individuals may find themselves more easily frustrated, anxious, or depressed, making it challenging to maintain healthy interpersonal relationships and cope with the demands of daily life. Over time, the persistent emotional imbalances resulting from sleep problems can contribute to the development of more severe mental health conditions, such as clinical depression, anxiety disorders, and bipolar disorder. The link between poor sleep and suicidal thoughts and behaviors is particularly alarming. Studies have shown that individuals with sleep disorders, such as insomnia, are at a significantly higher risk of experiencing suicidal ideation, attempting suicide, and completing suicide. The lack of restorative sleep can lead to a heightened sense of hopelessness, despair, and impulsivity, increasing the likelihood of individuals engaging in self-harm or suicidal acts. Recognizing and addressing sleep problems can be a crucial step in preventing these devastating outcomes. The consequences of poor sleep extend beyond the individual, impacting their social functioning and relationships. Individuals who struggle with sleep may find it challenging to engage in social interactions, maintain healthy boundaries, and effectively communicate their needs and emotions. This can lead to strained relationships, social isolation, and difficulties in forming and sustaining meaningful connections with others. The negative impact on social well-being can further exacerbate mental health issues, creating a vicious cycle. In an attempt to cope with the distress and discomfort caused by poor sleep, individuals may turn to substance use and abuse as a means of self-medication. The use of alcohol, drugs, or other substances can provide temporary relief from the symptoms of sleep deprivation, but ultimately, it can lead to a dangerous spiral of addiction and further deterioration of mental health. The comorbidity of sleep disorders and substance abuse is well documented, underscoring the importance of addressing both issues in a comprehensive manner. The physiological mechanisms underlying the sleep-mental health connection. To fully understand the devastating consequences of poor sleep on mental health, It is essential to examine the physiological mechanisms that underlie this complex relationship. The human body operates on a 24-hour internal clock, known as the circadian rhythm, which regulates various physiological and behavioral processes, including sleep-wake cycles. When this delicate balance is disrupted, it can have far-reaching implications for mental health. Disruptions to circadian rhythms, often caused by factors such as jet lag, shift work, or exposure to blue light from electronic devices, can lead to desynchronization between the body's internal clock and external environmental cues. This misalignment can contribute to the development of various mental health issues, including mood disorders, cognitive impairments, and increased risk of psychiatric conditions. Sleep deprivation can also disrupt the delicate balance of hormones in the body, which can have a significant impact on mental health. For example, lack of sleep can lead to an imbalance in the production of cortisol, the primary stress hormone. Chronic high levels of cortisol can contribute to the development of anxiety, depression, and other stress-related mental health conditions. Additionally, poor sleep can affect the production of neurotransmitters, such as serotonin and dopamine, which play crucial roles in regulating mood, motivation, and cognitive function. Sleep deprivation has also been linked to increased inflammation and immune system dysregulation, which can have detrimental effects on mental health. Chronic inflammation, a hallmark of sleep disorders, has been associated with the development of various mental health conditions, including depression, anxiety, and cognitive decline. This is due to the complex interplay between the immune system, the central nervous system, and the brain, where inflammation can disrupt normal brain function and contribute to the onset of mental health issues. Adequate sleep is essential for the maintenance and optimization of neuroplasticity, the brain's ability to adapt and change in response to experience. Sleep deprivation can impair this crucial process, leading to reduced cognitive flexibility, impaired learning and memory formation, and even structural changes in the brain. These neurological alterations can contribute to the development of various mental health disorders, including depression, anxiety, and neurodegenerative diseases. The relationship between poor sleep and mental health challenges often resembles a vicious cycle, where one condition exacerbates the other. This cyclical nature can make it challenging to break free from the detrimental effects of sleep deprivation on mental well-being. On one hand, poor sleep can directly contribute to the development and worsening of mental health issues, as previously discussed. Individuals struggling with mental health conditions, such as depression or anxiety, may find it increasingly difficult to achieve the quality and quantity of sleep they need, further perpetuating their mental health struggles. On the other hand, the presence of mental health challenges can also disrupt sleep patterns and quality. Symptoms of mental health disorders, such as rumination, hyperarousal, and irregular sleep-wake cycles, can make it challenging for individuals to fall asleep and stay asleep, leading to a vicious cycle of poor sleep and deteriorating mental health. This bidirectional relationship highlights the importance of addressing both sleep and mental health concerns simultaneously, as improving one can have a positive impact on the other. Interventions that target sleep hygiene, stress management, and mental health support can be crucial in breaking this vicious cycle and promoting overall well-being. Tired of tossing and turning in bed, counting the hours until dawn? The time has come to transform your nights. With the ebook, Sleep Well: Practical Solutions to Overcome Insomnia. In it, you will discover effective techniques based on reliable research. Click the link in the first pinned comment to get your copy and start changing the way you sleep today. Recognizing the devastating consequences of poor sleep on mental health is the first step towards addressing this critical issue. However, it is equally important to explore effective strategies and interventions that can help individuals improve their sleep quality and protect their mental well-being. Establishing consistent sleep-wake routines. One of the most effective ways to improve sleep is to establish consistent sleep-wake routines. This involves going to bed and waking up at the same time every day, even on weekends, to regulate the body's circadian rhythms. Creating a relaxing pre-bed routine, such as engaging in gentle stretching, reading, or practicing mindfulness, can also help signal to the body that it's time to wind down and prepare for sleep. The environment in which we sleep can have a significant impact on the quality of our rest. Ensuring the bedroom is dark, cool, and quiet can promote better sleep. Eliminating exposure to blue light-emitting devices, such as smartphones and tablets, in the hours leading up to bedtime can also help regulate the body's natural melatonin production and improve sleep. Incorporating stress management techniques. Stress and anxiety are common contributors to sleep disturbances and can have a detrimental impact on mental health. Incorporating stress management techniques such as meditation, deep breathing exercises, or progressive muscle relaxation can help individuals better cope with stress and promote relaxation, leading to improved sleep quality. Regular physical activity has been shown to have numerous benefits for both physical and mental health, including improving sleep quality. Engaging in moderate-intensity exercises, such as walking, swimming, or yoga, can help individuals feel more tired and relaxed in the evenings, facilitating better sleep. In some cases, individuals may require professional assistance to address persistent sleep and mental health issues. Consulting with a healthcare provider, such as a sleep specialist or a mental health professional, can be crucial in identifying underlying causes and developing a personalized treatment plan. This may include cognitive behavioral therapy, CBT, for insomnia, medication management, or a combination of various evidence-based interventions. The devastating consequences of poor sleep on mental health cannot be overstated. From cognitive impairment and emotional dysregulation to increased vulnerability to substance abuse and suicidal ideation, the impact of sleep deprivation on our mental well-being is profoundly concerning. By understanding the physiological mechanisms underlying this complex relationship and recognizing the cyclical nature of the problem, we can take proactive steps to prioritize sleep and protect our mental health. Through the implementation of consistent sleep-wake routines, the optimization of our sleep environment, the incorporation of stress management techniques, and the integration of regular physical activity, we can empower ourselves to break free from the vicious cycle of poor sleep and mental health challenges. Additionally, seeking professional support and embracing a holistic approach to well-being can provide the necessary resources and strategies to achieve sustainable improvements in our sleep and mental health. It is crucial that we, as individuals, healthcare providers, employers, and policymakers, recognize the urgency of this issue and work together to create a society that prioritizes sleep and mental well-being. By doing so, we can unlock the extraordinary potential of our minds, forge stronger connections, and cultivate a world where mental health is valued and protected, one good night's sleep at a time.